So whenever we damage something, let's go back to our skin. Here's our skin. And we'll just actually do one layer of skin. So this is our stratified squamous. And then underneath it, we have things like connective tissue. So different connective tissue like dense irregular, and we have bones under there, and we have blood under there, and we have all that stuff. So along with connective tissue, we've also got muscle down here, and we've got nerves down here. So the whole point is we have a bunch of stuff that we don't want to get infected. Okay, so if we injure this, we want to have some protection before we get down there. But if we do have some damage, so we nick this stuff and we cut that open, well, we're going to have to repair this. So what are the stages of tissue repair? Once we cut this with, let's say, a branch from the botanical gardens or something, so that cuts your skin open, we need to repair it. So what are the stages to tissue repair? Well, the repairing itself, we have two different types of repair. We've got regeneration and fibrosis. So these are going to take place a lot of the time simultaneously. It's not like they're events that are independent of each other. A lot of the times, if it's a small injury, you'll just have regeneration. But if it's a bigger injury, then you'll get some fibrosis and then eventually some regeneration. So what is regeneration? It's replacing a type of tissue with the same type of tissue. I promise I'm working on getting this new stylus. Fibrosis, osis is an abnormal condition, and fiber talks about fibers. So this is a lot of fibrous connective tissue. This typically leads to a scar. Scars can eventually fade because eventually they get replaced by the tissue the tissue that was there before. That's why you've seen scars and they disappear over the years, because eventually the skin replaces itself or whatever. Sometimes the fibrous tissue is never replaced though, and it stays a scar. Some people have a genetic disposition to fibrosis or scarring, and we call their scars keloids. So remember, these things can work together. Healing can take years to finish. It's pretty crazy. So this is our actual repair, but we have some steps before we get to that. So first we're going to have inflammation. Then we'll have these organizational events. And then we'll get regeneration and fibrosis. Let's start with inflammation. If you remember, this is an important thing to remember for this class, nothing in the body happens without a signal. So our signal is our damaged cells. So our damaged cells are going to release some chemicals, and that's going to cause, we'll say 3 different types of cells that are going to release chemicals. So the first step is damage. That damage is going to cause cells to release, and these cells that you give those epithelial cells that are damaged, macrophages, and something called mast cells. We'll talk about those more next semester when we get to immunity. But these different types of cells are going to release chemicals. That's all we're going to call them right now. Next semester we'll give them more specific names. But right now they're just chemicals. Alright, these chemicals are going to cause our capillaries to dilate, and that allows for more blood flow. And don't worry, I'm going to go through a picture with each of these, but I just want to get the words down. So our capillaries are going to dilate. That's going to allow more blood flow to come in, bringing things like white blood cells and clotting factors that are going to help get rid of all the damage and then help plug that hole. And then, so we'll get things like white blood cells, clotting proteins, fluid. All this is going to leak out into the site of damage. Next, our clotting proteins are going to make a blood clot. And that blood clot is going to form into a scab. So let's get a picture for this. Let's get a picture. So here's my epithelial tissue, and we'll have an underlying blood vessel. We're not going to damage the blood vessel today. We'll save that for another time. So let's damage this epithelial tissue though. And these cells are going to release some chemicals. And maybe we have some macrophages and mast cells hanging out. They'll release some chemicals. These chemicals are going to cause this blood vessel to dilate. So instead of looking like that, now we've got a bigger blood vessel. So it's dilated, which is allowing more blood to come in, bringing more white blood cells and clotting proteins. And when you dilate a blood vessel, it becomes leaky and permeable. So now these white blood vessels can escape, and the clotting proteins can escape. And let's say our pathogen is this little circle purple thing. Well, now these white blood cells can come and destroy this pathogen. And these clotting proteins can come and plug this hole. So I like to do my blood clot because it's going to eventually form a scab to be brown. So that is inflammation. From the cut to the blood clot, that is inflammation. Let's go through the word steps. Now that you've seen the picture, you kind of have a visual representation. Let's go through the words one more time. First, you have damage, okay? Then you need a signal for the body to respond. So the damage is going to cause these epithelial cells, these mast cells, and macrophages to release these chemicals. All right, these chemicals are going to cause the capillaries to dilate. That's going to allow more blood flow to the site of damage. This is a local dilation, not systemic, so you don't get blood vessels dilating throughout the whole body, just where this damage occurs. So as more blood flows in, that means more white blood cells and clotting proteins. Those clotting proteins can all leak out along with the white blood cells, and these clotting proteins will make our blood clot. That blood clot's going to lose moisture and become a scab. So now that we have our scab, we're done with inflammation. Next, we need to move to organization. So we need our picture. I'm going to draw a better picture. Here's my blood clot. And you know scabs are kind of raised, right? So we'll do it like that. All right, so the first step in organization, because that's what we're on now. Remember, after the scab, you move on to organization. So the first step, this blood clot underneath it, we're going to get this stuff called granulation tissue. And granulation tissue, it's fibrous. So if you've ever picked a scab and it's not still bloody or whatever underneath and you just see that pink layer skin, that's granulation tissue. So it's going to have a lot of those cellular structural elements, things like that, ground substance, which is the background fluid, and those proteoglycans and the different types of fibers. Okay, so this is basically a bunch of connective tissue. And that granulation tissue is going to have fibroblasts in it. So those fibroblasts are going to produce different fibers like collagen, elastic, and reticular fibers. So that's this first step in organization. Next, let's say we did destroy this capillary a little. Let's just say it's really screwed up. Well, we need to establish new capillary beds. So now we're going to bring in more nutrients using these new capillaries that are working well now that they're not damaged. So that's the new capillary beds, and let's actually, you know what, we can even do this. Let's put that old capillary back there that was giving us our nutrients, because that's way deep down here. And then let's just say that this area needs some more blood flow, so we'll just draw in some new capillaries like that. All right, next, these fibroblasts are going to close the margins of the wound. What that means is that it's going to move the wound closer, the edges closer to each other. Next, macrophages, we'll draw those little cell eaters like this. They're going to digest that blood clots. They're eventually going to make it go away. And then these collagen fibers, more collagen fibers are laid down. So once we've come to here, then we're either going to continue with fibrosis, just keep on laying down fibrous connective tissue, or if these margins are close enough, then they can start dividing outward like this, and that's regeneration, right? So regeneration and fibrosis are the last steps. We already talked about those at first. So let's go through the whole thing. You have damage to some tissue, maybe your skin. That's going to cause this epithelial tissue, these macrophages and mast cells, to release chemicals. These chemicals cause the capillaries to dilate, which allows more blood flow, which is bringing in more white blood cells and clotting factors. Since you have this dilation of the capillaries, you get this leaking of all this different stuff out, like clotting proteins and white blood cells. White blood cells can go destroy whatever pathogens are trying to get in. Clotting proteins can make a blood clot, which will eventually turn into a scab. Nice. Then we went into organization. First step is laying down this fibrous connective tissue, and I guess I'll write this stuff down. 1, blood clot is now, which is really a scab. Then we put granulation tissue under that. And granulation tissue is just laying down fibers and ground substance, all that connective tissue stuff that we talked about. After that, we're going to have the new capillary beds reestablished, so new blood flow, bring in all these nutrients. After that, we need the fibroblasts to close the margins of the wound, so bringing those edges together. So close margins of wounds, and that's bringing the edges closer. We'll have macrophages digesting the blood clot. And then more collagen fibers laid down by fibroblasts. And then once this was organization, and then once we have these collagen fibers laid down, then we can either continue with fibrosis or switch to regeneration. I would encourage you to write out all these steps for yourself, cover them up, try to go through them, try to rewrite them. Go ahead and rewatch this the last however many minutes, 15 minutes or so. Cool. So that's it. That's tissue repair. Now we want to look at some things that are going to affect the rates of tissue repair.